Good evening, everyone. Allison Skalberg here. We're happy that you have joined us this evening. We are with ADDA-SR, the Attention Deficit Disorder Association. We meet the last Tuesday of most months. We usually take a break during the summer. ADDA is an organization. Our group is mainly a parent group for parents who have children that have ADHD. And we have different speakers every single month that talk on a variety of different topics. You name it, we've probably talked about it. Um, all of our meetings are recorded. Everybody that has signed up for tonight's webinar is going to get a copy of tonight's slides as well as a link to the recording, so you don't have to take notes on everything that you see here. We are in webinar mode tonight, and what that means is that we can't see you or hear you, but we do know that you're here. We're glad that you're here. We invite you to put questions in the chat box. And we'll get to just as many questions as we can during the hour that we have together this evening. We are excited to have Dr. Lindsay Asawa back with us, and she is going to talk to us about testing, the benefits of testing, and when you might, should be looking at that for your loved one and how often and that kind of thing. So thanks for being here, Lindsay. I also just want to mention, ADA is an organization that you can join. The membership is really cheap. It's like, I think it's like $40 a year. There are support groups all across the state, all across the greater Houston area. So if you are a parent or an adult that also has ADHD and can benefit from adult groups, check it out. Because there are groups all around the area, and our group is specifically for parents and related to helping you with your child that has ADHD. So I just wanted to mention that. ADA also has a conference that is also very, very good. I know Lindsay and I have both attended that conference in the past, and they bring in speakers from all across the country on really, really great topics and authors that have authored books on the topic and things like that. So you'll want to check that out as well. Attending this webinar never means that you have to join ADA, but we will, when we send that email out with the slides and a link to the recording, there'll be a membership application, and it'll kind of give you instructions should you want to join, how you can join that organization. Okay, so having said that, Lindsay, I'm going to turn it over to you. Thanks for being with us
Okay,
tonight.
thanks, Allison. Okay, so let me get started. So I'm Dr. Asawa, Lindsay Asawa. I'm a licensed clinical psychologist. I'm going to talk about, does my child need to be evaluated? How you know when to evaluate, and really just kind of lots of information about psychological and educational testing and how it can be helpful. And I am an evaluator myself. That's all that I do. My practice, let me go to the next slide and show you a little bit more about my practice. We're in Missouri City. My practice is Beautiful Brain Psychological Services, and I was previously the co-owner of Missouri City Family Counseling. So I'm in the same location, just branched off and doing only a testing practice at this point. So we don't offer therapy. But we do refer families out for therapy when needed. And I get that question a lot. But the three of us, myself, and then the two other evaluators up here on the screen, Nicole Moore and Tanya Henderson, we all work together, and we evaluate children through adults. And Nicole and Tanya are both LSSPs, school psychologists as well, which is a licensed specialist in school psychology. And both of them are wonderful, and they've been doing this for years. They also work for Fort Bend ISD, so they have a lot of unique knowledge and experience. So I love working with them, and we all kind of work as a team. I have my website up here, and email and phone number. So if anyone needs to contact me with any questions after today, then feel free to do that. I'm happy to answer questions or send you to the right direction. My website has a tab with lots of helpful resources and referrals for therapists, for psychiatrists, links to other webinars. So I love helping families and providing resources whenever I can. So feel free to reach out. So the first question is, do I need to evaluate my child? So today I'm going to be focusing on evaluations for children because that's what I specialize in. That's what my practice specializes in. But we also do evaluate adults. And a lot of what I'm going to talk about today applies to adults as well. If you're thinking about an evaluation for yourself or another family member. But we're really, there's two major reasons that we might be doing this. One is if we have concerns. Um, and here's a list of just some of the common concerns that families might be coming in seeking an evaluation for. So they might be seeing some delays in their child's development all the way as early as at 1 to 2 years old. But we also see some developmental delays later on, and we may need to further assess those delays and see what's going on. If there's behavior concerns, if the teachers are mentioning there's issues at school. As far as learning goes, if your child is either having trouble learning, and they're not really working up to their potential. Or on the other end of the spectrum, if you have a child who's very advanced in their learning and they seem to be getting bored in school, we also do a lot of testing for children who may be gifted so that we can identify their needs as well. Of course, if they're having some attention issues, so we do lots and lots of evaluations for ADHD, which is why I'm involved in this organization. And if you're seeing any unusual behaviors or repetitive behaviors, that's also kind of a red flag that we might need to do some further assessment. If there's some social difficulties with peers, that can be for a variety of reasons. So we might need to assess. So these are just some of the concerns that you might be seeing. But there's other goals of these evaluations, and I do them for lots of different reasons, and they can be helpful in so many ways. We might need to clarify a diagnosis. So even therapists, other therapists will refer to us for an evaluation because they're uncertain of what's going on. They've been working with a client for a little while and they may refer you over to us trying to figure out what is the underlying diagnosis, and we can help with that. We also can, through the educational testing that we do, we can figure out a child's learning style and what their needs are, because sometimes this maybe the school is not the best fit for them, or the way that their school and school environment is designed is not designed for their brain and how their brain works. So we can kind of figure out, how does their brain work? What do they need to learn best? What type of environment, what type of strategy, teaching strategies? So we can help identify that. And I do have clients coming in that there's not necessarily any concerns going on. I've had several evaluations that the child was doing well, but the parents wanted to learn more about their learning style, the way their brain is wired, what their strengths and weaknesses are. And we're able to kind of help with that and give the parents some guidance so that they can make choices about school placement. They can figure out, how to support their child at home with their learning. We can also help with treatment plans and giving you specific treatment referrals. So these evaluations can send us in the right direction as far as treatment. If we can identify a diagnosis or, a cause for some of the concerns that we're seeing, then we can tell you what are the best, most evidence-based treatments to address this diagnosis or these concerns. And we also are trained to know who in the community to send you to and where to direct you. So that's kind of part of our job when we do these evaluations. For some services in the community, in order to qualify for those services, you need a diagnosis. For example, intellectual delays or intellectual disabilities, as well as autism, giftedness. Some of those, we need to identify that diagnosis first in order to qualify a child for services. Um, at the same, along the same lines, for insurance purposes, sometimes to get coverage for treatment, in order to qualify for that, a child needs a medical diagnosis. They may be evaluated through the school, and we'll talk about that later, but they may need a medical diagnosis, which the school is not able to provide. And so we're able to do an evaluation that does provide a medical diagnosis. So you might be able to receive insurance coverage for treatment. And then I also get lots of referrals for evaluations in order to seek accommodations on standardized tests. So these are maybe high school students who are going to be taking the SATs, ACTs, or AP classes, AP tests, and then also beyond that. So students that are going on to college and are seeking accommodations in college, but also on postgraduate testing like MCATs, LSATs. We've helped students receive accommodations on all of these different types of testing. And they do need to have a full evaluation in order to qualify and to apply for those. So these are all reasons that these evaluations can be helpful. There's many, many different um, goals of these evaluations. And I wanted to clarify some of the different types of evaluations that we can offer. Now, and this is not just speaking for my practice, but this is kind of in general across the board. Most psychologists who offer testing are going to offer similar types of testing, but there might be certain things that one psychologist may not have experience or may not specialize in, whereas another one might. So, but these are some general types of evaluations. So psychological versus educational. So when we're talking about a psychological evaluation, it's not going to necessarily include academic testing. So for a psychological evaluation, we're looking more at a person's emotional and psychological functioning and behavioral functioning. And we may also include cognitive testing in that to look at their abilities and their cognitive functioning as well. So kind of their overall well-being, and also to help with the diagnosis. So when we do psychological testing, that's what we're looking at. With educational evaluations, they really more are what they sound like. So they're looking um, at any educational needs, any academic or learning issues. They're assessing for learning disabilities or giftedness. And so we do some academic testing as well as some cognitive testing. So we can look at their abilities, their cognitive abilities, and are they learning up to that potential? So that's the difference kind of between those two types of evaluation. I get lots of questions about what is the difference between a neuropsychological evaluation and a psychoeducational evaluation. And these terms are used um, interchangeably by lots of pediatricians in the community, and by just kind of the general public. People might say, you need to get a neuropsychological evaluation for your child. And what they might mean is what I would refer to as a psychoeducational evaluation. So I do want to explain kind of the difference between these. So oftentimes people are talking about the same thing when they use these labels or these terms, and they really are talking about just a full comprehensive evaluation that includes cognitive testing. It includes a lot of the things listed there under that types of testing label. So cognitive or IQ testing, it might include academic. If it's a psychoeducational evaluation, it does include academic testing. It might include developmental or autism testing if that's one of the concerns. It might include ADHD testing if that's a concern, and it would include some emotional and behavioral assessments through some questionnaires for parents, for teachers, as well as having the child or the teen fill out some questionnaires as well. And then sometimes it can include other types of testing, like personality testing, projective testing. But there is neuropsychological testing that is kind of a separate thing that only trained and experienced neuropsychologists can administer. That is necessary when someone is concerned about possible cognitive or brain related issues. So a neuropsychologist will do cognitive or IQ testing, just like a psychologist who's not a neuropsychologist like myself. We both do IQ testing, but neuropsychologists also can do some additional tests that look at other areas of the brain and the functioning of the brain. And so they also can look at things like dementia. They can look at the impact of brain injuries. They can look at some additional brain related issues and neurological issues. And so generally, if what you're looking for is an evaluation for autism, for ADHD, for a learning disability, for giftedness, those are things that can fall under this psychoeducational category. You don't necessarily need specific neuropsychological testing for that, and you don't necessarily need to seek out a neuropsychologist for that. You can, and they can also offer that type of testing, but we both overlap in those areas. So I've gotten lots of questions about that because that can be very confusing when pediatricians say you need a neuropsychological evaluation. Typically, they mean the same thing. So feel free to reach out if you have other questions about that, because I know that is a confusing category. So I wanted to mention a little bit more about IQ testing because this specific category, there's a lot of information and I get lots of questions from families about IQ testing. And one thing to know is when we do IQ testing or cognitive testing, it does not look at all types of intelligence. So we're not necessarily, we're not assessing for artistic abilities or emotional intelligence. We're looking at very specific forms of intelligence or cognitive abilities, and only what is assessed by the tests that we have. So, for example, I use the Wechsler tests, and you'll hear the terms WISC and WACE and WIPSI, and those are all Wechsler tests. And those tests assess 4 or 5 specific cognitive abilities, and that's all. And so I can give you information about those abilities when I do that testing. And I can give you their overall score, which doesn't mean as much as those individual abilities because it tells us about their strengths and weaknesses, which is really what we're trying to figure out. What are some of their strengths and what are some of their weaknesses? Another thing to know is that even though one of these tests can be administered to a wide range of ages, like the WISC can be administered to from age 6 to 16, but we're only scoring based on their age. So I'm only comparing 6-year-olds to other 6-year-olds. They are doing the same test that a 16-year-old is given, but I'm only comparing them to their age group, if that makes sense. These tests do have to be administered by someone who's trained and licensed to administer them. So this is true IQ testing that you really have to seek out a psychologist to administer this or a licensed evaluator to administer them. There's lots of tests online that claim to be IQ tests that are quick little, things that you can fill out yourself online. Those are not true IQ tests and cognitive tests. They're not going to give you the information that someone who's trained and experienced in interpreting and administering these types of tests can give you. It takes about an hour and a half to 2 hours to administer, and it's not just something we do on the computer. This is something that's a variety of activities. We have hands-on activities. We show pictures and patterns. We do some question and answer activities. We do some paper and pencil tasks. We do lots of different things because we're trying to look at all these different abilities. So I also want to mention, sometimes people ask when we're doing an evaluation for ADHD, why would we need to include IQ testing? Or for autism, why would we need to include IQ testing? And it gives us some other information in addition to the cognitive abilities, which are important. We need to know what are their abilities and what are their strengths and weaknesses, because that does help us with a diagnosis. But the other thing we need to look at is their interactions and the way that they react to things, the way that they approach different activities. All of that gives us information. And as a psychologist, I'm trained to interpret all of that. So when I spend an hour and a half or 2 hours administering this with a child, I'm watching everything and I'm picking up on everything that I observe with that child. And I'm also noticing, how they handle different things. Do they fidget a lot? Do they need to get out of their seat a lot? Do they take a lot of breaks? Do they rush through things? Are they getting distracted? I'm watching for those things that are going to be helpful with making a diagnosis. So this test is very, very helpful as part of a full evaluation. And another thing to know is there are certain patterns of scores that we see that help us also determine or that contribute to our diagnosis. So kids with ADHD, for example, they tend to have weaknesses in certain areas on cognitive testing. So we're able to look at that and help with the overall puzzle of piecing everything together. It is important to know also that if you have a child that is neurodivergent, so maybe they are on the autism spectrum or they may have ADHD, those kids may actually, when they are given cognitive testing, they may have some areas that are not 100% accurate as far as the scores go. They may have some underestimate scores because, there's times when they're distracted or there's times when they are rushing and they're overlooking details. It's because of the symptoms of the diagnosis and it impacts their performance on the testing. And so I do share that with parents. When I see that, I will give them that feedback and I will say, this score is likely an underestimate of their true abilities because of what I observed during that test. Um, the last thing is I have on here school versus private giftedness testing. So kids in public schools are going to be tested for the GT program. And public schools use a different test than what we use. And the assessment that they use is designed to be able to be administered in groups, and it's designed to take less time. And so it's easier to administer in schools. It's still very helpful in the information that it provides, but it does not provide as much information as the tests that we can administer individually. And we can do that in private practice. We can administer these tests that take 1.5 to 2 hours that look at lots of different things. So the other thing is it's a different environment. And so I have kids who were tested in the schools. They were not identified as gifted. Their parents felt like that just seems off from what I know about my child. So then the parents will come and ask for a separate evaluation, and we will do that. We will administer a different test, like those Wechsler tests that I mentioned, and that child may test as gifted. And it's because they're one-on-one in a different environment. There's less distractions. We're able to get the best out of them. When I work with kids, they're taking breaks whenever they need to take breaks. They can get up and walk around the room. I have fidget toys in there. They can move. They can just be themselves. I also have ways I can motivate them to stay on track and keep going and keep trying. And so I feel like usually in that setting, we can really get the best out of them. So that is sometimes a reason to, if you're not sure about the testing through the school and how that turned out, it can be helpful to kind of get that second opinion. And so that's something that we've done pretty often. A question about who can evaluate your child. So this also can get very confusing. There's lots of letters behind people's names and lots of different credentials and professionals out there. And so it's hard as a parent to know who should I seek out to do these types of evaluations. Licensed psychologists, like I'm a licensed psychologist with a doctorate degree. I have a PhD, but a PsyD is another type of doctorate degree that allows you to become a licensed psychologist. So that's, of course, a category of professional who is trained and experienced in doing these types of evaluations. Licensed neuropsychologists, as I mentioned earlier, they also are trained to do the same types of testing as well as some additional testing for neurological issues. They also have a PhD, in most cases, and licensed psychological associates, LPAs. So that is someone who is trained and licensed also to practice independently. So in private practice, an LPA can also conduct these evaluations. Now, psychiatrists, licensed psychiatrists and nurse practitioners, so they have medical degrees, so they go through a different route of training, but they also are sometimes trained to administer some types of testing. Now, they are not going to be providing educational testing in most cases, but they can often, some psychiatrists and some psychiatric nurse practitioners will be able to provide some ADHD testing, and some behavioral assessments and emotional assessments. So they might be able to diagnose, ADHD, obviously, but also things like depression, anxiety disorders, of course, other mental health related diagnoses. But if what you're wanting is a more extensive, more comprehensive evaluation, like those full psychoeducational evaluations that I talked about, then a licensed psychiatrist or a nurse practitioner is not going to be able to do that. Now, school psychologists, like the two that work with me at my practice, they have a license in as a specialist in school psychology. In the state of Texas, so LSSPs are placed in the schools in Texas, and they conduct or oversee the evaluations in the school districts. And they can also conduct evaluations in private practice. And so that's why I have the two that work with myself. They also work in Fort Bend ISD, and they do evaluations through the schools, and they're doing evaluations through my practice. An educational a diagnostician can administer the tests, but has to be supervised by a school psychologist or a licensed psychologist. So that's some of the different professionals that can do this type of testing. So be aware when you're seeking out someone to do an evaluation for your child, just be aware of their credentials and their training, their background, to make sure you're choosing the right person. Um, some things that we can learn from evaluations. This is a kind of a off the top of my head list, but there are actually many other things that we learn as well. To me, I see these evaluations as like puzzles that I'm piecing together. And I'm trying to just figure out this child and figure out their brain, how their brain works. So I can look at their strengths and weaknesses. I can figure out what might be causing some of the behaviors that they're struggling with. I can look at their academic skills and where they're at. Are they at grade level where they need to be, or are they behind in certain areas? I can, like I said earlier, I can figure out their learning style and how they learn best. And what types of educational settings would be best for them? What types of accommodations might they need so they can be successful in school? And then, like I mentioned earlier, treatment modalities, based on working with this child and assessing them, we can figure out what type of treatment might be helpful for them based on their diagnosis and what else we're seeing from them. And what we do in our evaluations, and what many psychologists do, and I would encourage you to ask about this if you call someone to schedule an evaluation, is to make sure that they provide recommendations, because you don't want to leave the evaluation with just a diagnosis. And I have had clients come in and show me that they've had evaluations and they were given a diagnosis, but that was it. And they never really knew where to go from there. And they never fully understood that the results of that evaluation. So make sure that your evaluator is willing to sit down with you and go over those results, explain them, explain the diagnosis to you, and to give you some specific recommendations based on the evaluation, because that's why you're doing this, is to get those recommendations. And some of those might be some parenting strategies. So based on what we learn in that evaluation, we can even tell you as a parent, here's some things I think would be helpful when you're dealing with their behaviors at home, or trying to motivate them to work differently in school. We can give you some strategies. And then at the top there, I kind of skipped over, but there's a lot of diagnoses that we can assess for. Of course, ADHD, autism, specific learning disorders like dyslexia, dysgraphia, dyscalculia. We can look at both giftedness as well as intellectual disabilities. We can look at assess for mood disorders. We can look at depression, anxiety disorders like PTSD, OCD, generalized anxiety disorder. So there's a lot of different things that, as a psychologist, that we're thinking about. And we use a diagnostic manual, the Diagnostic and Statistical Manual of Mental Disorders. And that manual is kind of is what we all use, and that we follow that criteria, and we are assessing based on that criteria so we can make a clear diagnosis. So a lot of families are kind of wondering, what does the process include? Like, what does it entail? The biggest question I get is about insurance versus self-pay, and that's a great question. And so our practice, we do not accept insurance for our evaluations. And there's a reason why. So insurance companies, and you'll find that a lot of psychologists, unfortunately, are out of network with insurance when they do these evaluations. And it's because the insurance companies really try to kind of micromanage how we evaluate a child. They try to have a lot of say in what assessments are used and how much time we're allowed to spend on that assessment or interpreting it. And they, of course, they also don't reimburse at a level that most psychologists are really able to make it worthwhile, because we put in many, many, many hours into these evaluations. And so that's one of the reasons, or the kind of some of the reasons why many psychologists are not in network. Now, some are. Oftentimes, when they are in network, they may have a little bit more of a wait list. And so, what you can do if you're wanting to try to go through insurance is to contact your insurance first and ask them who is in network in your area that is a licensed psychologist or one of those evaluators that I listed. And you can go that route. And another option is to check your out of network benefits, see if you have some coverage there that you could apply the cost of the evaluation to a deductible or get some reimbursement for it. So we have a lot of our clients that do that, and they request a super bill so that they can get some reimbursement or apply it to their deductible. But as far as self-pay goes, so some practices, our practice uses a flat rate. So we have one rate for each type of evaluation, and that rate includes everything that's involved. And that way families can kind of know upfront and plan for the evaluation, and they know the full cost. Now, some practices do charge by the hour, and so it's a little bit less predictable as far as the total cost, but they will generally give you a range. Especially sometimes they'll want to meet with you first for the intake appointment, and then they might give you a range of the total cost and where it might fall. So that's generally how practices do it. Now, these are the steps that are involved in the process. If you're evaluating a child, like we often are, then we do some parent questionnaires. We have teachers fill out questionnaires, and parents ask me, is that really necessary? And I say, yes. If the parents are comfortable, I really like to get the teacher input. It's very important, because we can't only rely on what parents are seeing at home. We have to know what is being observed in the classroom, and public schools especially won't let us get in there. And so we need somebody's observations from that environment. And so the teachers can give us some really helpful input, and we don't just rely on that. So we just take it into consideration, and we consider everything else as well. With private schools, sometimes we are able to do a classroom observation, or with preschools, sometimes we're able to do that. And that might be something that's included, especially in an autism evaluation. And we would go in and do some observations of the child in the classroom. Um, and then we do, of course, do a parent interview, and any good evaluation should include a parent interview. And our interviews take, an hour to an hour and a half. So you need to really spend some time sharing the history of your child, your concerns. This can be either virtual or in person, but that part is very important, because the evaluator needs to know that history and needs to have their questions answered. The testing session, some people will do it in one day, some people will do it over multiple days. At our practice, we've tried both methods. We prefer trying to do it in one day, because it seems to be more convenient for the families. The kids do well with that because they get really comfortable with us, and we're able to get lots of good observations throughout that time. But the way that we do that is we make sure that we take breaks whenever they need it. The timing is flexible. So if they need to take a longer lunch break and then come back and finish, or if they're just done for the day, then we stop and we'll reschedule on another day. So we have to kind of go at their pace. And I would encourage you to look for that in any practice that you're doing this with. We don't want it to be too rigid, because we're working with kids and we have to have some flexibility. Mornings are always best. So I have families ask, can we schedule at 3 o'clock after school is out? And no, that does not work. And the reason is, these evaluations, we are trying to get the best out of them. So we need them to be fresh. We need them to be, it needs to be in the morning before they've gone to school. They need to not be tired and worn out for the day. They need to be ready to do lots of activities with us. Um, it typically takes at least a couple of weeks to have these reports ready. And some parents will come into this hoping and expecting that the report will be ready within a few days. Usually that's not the case because most good evaluations are going to give you a really detailed report, anywhere from 10 pages to sometimes even up to 20 pages long. And that takes time to score all of those results and put together that report and really think through the results. And so you would need to expect about 2 to 4 weeks for most evaluations to get those results. And then I think it's really important to have a results session with the parents to go over the results and talk through them. For us, that takes about an hour and a half. And we go over the report in detail, explain everything, go over the recommendations, talk about referrals if you need referrals. Um, and sometimes we also will do that with the child as well, either with the parent or separately from the parent, kind of depending on their age and depending on if that's needed. But it can be a really, really helpful thing for the evaluator sometimes to share some of those results with the child. The parents can also share the results, and the evaluator can talk to you about how to do that. But both can be helpful. But if you do an evaluation and they don't include that result session, um, I guess I would be a little more concerned about that because you need to know, you need to be able to really understand those results and what they mean and where to go from there. Because as a parent, I know that's what I would need. And that's kind of the purpose of all of this. A lot of parents also ask me, how do I prepare my child? What do I need to do? Do we need to practice? Are there some materials I can get for them that they can look over? And I tell parents, no practicing, no preparation, especially for IQ testing, because we don't want what we call practice effects. So if a child has practiced and they've seen these materials, then that's going to inflate their score and their score is not going to be valid. And we know that. I can tell you that we are fully aware when a child has been exposed to these materials recently, because it's hard for kids to hide that. So I have had kids come in and say, "Oh, I saw this. We were doing this at home." And then I have to stop the testing at that point because it would be invalid. And so it's unethical for us to do that. So no practicing or preparation, but you can give them a good explanation for what's going to happen, and that would be helpful. So what I like to use, some terms I like to use, is to tell them we're going to be doing some brain games, because they really do feel like games to kids. And a lot of the kids that come in, they really enjoy it. And when they leave, they say, "When do I get to come back?" And they say, "That was fun." So they are like games. We also tell them we're going to do some things to help me understand how your brain works and what you're good at and what you need help with. And I'm going to learn a lot about your brain. And we're going to do these activities that are going to help me learn that. A lot of kids wonder, am I going to get a shot? Do I have to take medicine? They're thinking of this as a doctor's appointment. So we tell them that it's not the same thing. There's no shots. We're not going to be doing anything like that. We're going to be doing some activities and some games, and we're going to be talking. And you can tell them that lots of kids do this, and it's kind of fun in a lot of ways. And that's really all the explanation you have to give them. And it's really important for them to have a good night's rest and have a good breakfast, because sometimes if they don't have those things, it does impact the test results. And then we have to include that in the report and kind of say that these results may not be valid because we had a child who was falling asleep during testing because they were so tired. Um, and parents ask me, do they need to take their medication when they come in? If they're already on a medication for ADHD, for example, I would say they need to take it if we're going to be doing academic testing, because I want them to be able to show me their best, uh, give me their best effort. And a child with ADHD is most likely going to be able to do that if they're on their medication. Um, Now, if we're assessing for ADHD, I don't want them to be on medication because I want to see the full story. I want to see all the behaviors and what they're struggling with. So that's kind of how to determine whether to use the medication or not. It's helpful to have snacks because kids get hungry and they're asking for snacks, and we like to feed their brain so we can keep them going, keep them motivated. And I always tell parents it's also helpful to plan something fun afterwards, because I do wear their brain out during testing. We do a lot of things there, and they're having to stay in this room with me. And so it's afterwards, a lot of kids that I work with, they need to burn off some energy. So it's helpful to maybe go to the park or go get a treat, go do something fun. So after the evaluation, what comes next? And these are just my suggestions. I do think it's helpful to save an electronic copy of the report. I have parents asking me years later, hey, do you still have a copy? I've lost that copy of my report. And sometimes they only printed out the paper copy and they lose it, they've moved. Or they didn't save the electronic copy. They assumed they could find it somewhere in their emails. So I really highly recommend save an electronic copy somewhere that you won't lose it. Because yes, we are required to keep those records for several years. But eventually we are allowed to destroy the records, and we are actually supposed to destroy them after a certain number of years. And so it's important for you to keep a copy. If the evaluator doesn't provide this for you, ask them for some resources and some referrals, because they should have that information and be able to give you some ideas. And like I said, on my website, we do have a resources tab with some good resources and referrals on there for you. And so you can feel free to check that out. Um, Parents ask, should I share this report with anyone? I think it's very helpful to share, because my opinion is anyone working with your child, I think you guys are a team. Everyone needs to be on the same page, and sharing that information with them can be very helpful. I know a lot of parents can be very reluctant to share with the school, depending on what the plans are. But in my experience, in most cases, sharing the feedback, the report with the school has been a helpful thing rather than a harmful thing, because it kind of lets the teachers know that there's a reason behind the behaviors they're seeing, and that this child needs to be worked with differently. Um, let's see. Make sure you start to educate yourself once you have the information. Then gather more information. There's lots of great books, lots of great websites. There's support groups like ADA. There's lots of good resources out there for you to educate yourself about the diagnosis and about how you can be the best parent to your child. And get ready to be their advocate, because you're going to need to be doing that over the next several years of their life. And that's the way that you can kind of arm yourself, is to educate yourself, gather resources, gather tools, so that you can then advocate for them.
Lindsay, I
Uh-huh.
wanted to chime in here because
Sure.
I wanted to talk about, getting outside testing versus, there's testing that the school does. And I have found having private testing done is vastly different than what the school does. Sometimes there's a little overlap, but the extensive testing that you need to really support your child and get them the tools and resources that you need, personally, I have found has come from outside testing. And there's nothing wrong with the school testing. The school is going to do their testing. They're going to decide what testing they're going to do. And that might not be in line with what you think needs to be tested. When you have private pay testing, you get done what needs to be done. And then you have fuel to go back to the school. The school doesn't have to take that outside testing, like as far as the public school, or usually they do take it on the higher education level. There's no issue with that at all, and preferred. But you have fuel to go back and say, no, there is something bigger going on. Because we've come across a lot of parents over the years where the testing and what the school says and what resources the school says they're going to provide versus what the kid truly needs are really two different things. So I just
Yes.
wanted you to chat about that, because I
Yes.
I know it's expensive and it's often not covered by insurance, right? Like
Mm-hmm.
out of pocket, you file it out of network with your insurance or what have you. But the information that I received from this was fantastic. Like it was very, very much worth it if your goal in mind is to meet the child where they are and to get them the tools and resources to help them to close the gaps on whatever those deficits are and help them in their life. So I just
Right.
wanted to share that.
Yes. Well, I'm glad you felt that way. And I actually, two out of my three kids I've had evaluated by outside psychologists, and it was incredibly helpful even to me as a parent. And I think that I think you're right that there's a lot that you can learn from these evaluations. I've had entire families get evaluated, which is fun because I get to literally evaluate every person in the family, both parents and all the kids. And there's so much that we learn from every evaluation of each of these people, each individual family member. But as far as the schools go, so I do have a couple of slides about that. This one I'm not going to go through, but I'm going to have it in here for you guys as a resource. And I just liked it and wanted to include it. And it goes through and explains the differences between Section 504 and IDEA, which are the two umbrellas under which you can get support through public schools. And there's a lot of similarities, but there's a lot of differences between these two umbrellas. And we could do a whole presentation on that today. And also there have been presentations done on this. So I would encourage you to check those out. We're not going to go into all of that, but this slide, I wanted to answer your questions, Allison, because, or speak a little bit more about this. I actually talked with with Tanya Henderson, who is one of the evaluators that works with me, who is a school psychologist with Fort Bend ISD, as I mentioned, and she gave me lots of this information to make sure that I can share with you some very accurate information about the school evaluations versus private. The way school district evaluations work is very different than the way it works for private evaluations because the purpose is different. And now I'll get to that in a second, but what they do, they do what they call a full individual evaluation, a FIE. In the one positive is that it is free. It's paid for by the school district, and anyone can refer the child, including teachers, but a parent has to consent in order for this evaluation to be conducted. So you don't have to consent even if the school wants to evaluate your child. Now, the key with the school evaluations is that they are trying to determine if the child meets the criteria for services, special education services, and they are looking at an educational need for services, which is very different, sometimes can be very different than looking for a medical diagnosis for treatment purposes and parenting purposes, but they are only thinking about educational need. So you can have two kids who have autism, but one child is determined not to have an educational need for services under that label of autism, even though they are on the autism spectrum, and maybe they have other needs that need to be identified. And so under these private evaluations, we're able to identify all of those needs, which we do have a little bit more freedom with that. We can include whatever assessments we want. We can assess for any diagnosis that we want. And we can also uh, give you recommendations about other things like treatment and parenting and other things that the school is not going to necessarily get into. They're looking at educational need. So what often happens is we do have kids who are evaluated by the schools, and it's determined that they do have an educational need for services as a child with autism. So basically the school evaluation does identify them as being on the autism spectrum, but that is not a medical diagnosis. And so if you want to seek treatment, for example, ABA treatment, which is a common treatment used for kids with autism, and if you want that to be covered by insurance, or even just to qualify for that treatment at all, you need a medical diagnosis. And so that is another reason that we have families coming to us to have a private evaluation so they can get a medical diagnosis, as well as some treatment recommendations, parenting recommendations, referrals for therapists, other things that we can provide. Now, the Texas Education Agency has 13 categories that kids can qualify for services under. So that's what they're looking for, is those 13 categories. Now, we have our diagnostic and statistical manual that has a lot more than that. So we are looking at diagnoses, right? At medical diagnoses. They are looking at these 13 categories, and does your child meet the need for services in one of these categories? So here's, as Allison was saying, so another thing that I get asked a lot is, if I do a private evaluation, is the school going to consider that, or do I have to just reevaluate them again through the school? So Tanya Henderson, who is the evaluator that works with me and who is a school psychologist, her inside information is that yes, they do consider those private evaluations. She said the evaluator at the school psychologist, they may use some of that private evaluation to support the child getting eligibility, or they may even use all of that evaluation if they feel like it was comprehensive enough and it had everything they need. They just need to make sure that it has everything they need, because in the community, evaluators are all going to do things a little bit differently. So the school needs to review that evaluation, see if it includes everything they need. If it includes a lot of what they need, they may just get a few additional pieces to add to it, and then use that to support a child's eligibility. So those private evaluations still are helpful for the school's purposes. The school has a time frame they have to follow. If they get a referral, they have 45 days to complete the evaluation. If the child is then eligible for services, they have 30 days to schedule what they call an ARD meeting to review and come up with a plan. And the plan is called an individualized education plan. And then after that, they have these ARD meetings at least once a year, every year that the child is in school, and they review the goals and that plan and see if the child is meeting their goals and what other services they need. They also have to determine if the child still meets the criteria for services. So at some point, some kids, they determine they no longer are eligible for services, maybe because they've met some of their goals, and so they're no longer eligible. And they do reevaluate them every 3 years through the school district. Now, this is important. Most parents don't know this, that if you have your child evaluated through the school and you disagree with the results, you do have the right to request what's called an independent educational evaluation, an IEE, which is done by an outside psychologist, a private psychologist like us, and it's paid for by the school district. And but you do have to go through a process. There's a process involved, there's a time frame involved. And so that is an option that's available to you as a parent, that under your rights, and most parents don't know that that exists. There's a lot of psychologists in the community that are on that list to provide those IEEs. But yes, I do think there's a lot of advantages of doing a private evaluation, and I know there's cost involved as well. And so it is one of those trade-offs to kind of think through if that's something that that you're able to do as a family financially, but there can be a lot of benefits from it. So the last thing that a lot of families ask is, do I need to, after we've done this process, okay, do I need to do this again at some point? Do I need to reevaluate my child? As I mentioned, the schools do it every 3 years. And the recommendation in general is every 2 to 3 years is a good idea, because a lot can happen in those 2 to 3 years with a child. A lot of progress can be made, but a lot of new issues can come up. And then there's other reasons we might reevaluate at different times in their life. We might need to look at progress. We might need to look at new concerns that might mean a new diagnosis. Sometimes the previous testing was not 100% accurate or complete because we had to stop testing for some reason, or the child wasn't able to give us their best effort because they were showing some early signs of ADHD, and those scores were underestimates, and maybe we want to get a more accurate score now that they're a little bit older. Now, sometimes insurance may require a reevaluation in order to continue covering treatments, and private schools in the area who provide accommodations, they also will require reevaluations after a certain amount of time. And then I get a lot of referrals for adults who have ADHD and who were diagnosed as children and who were on medication when they were children. And now as an adult, they have a new prescriber, or they're wanting to resume their medication, or they've moved to a new state, whatever it might be. and that prescriber is saying they need a new updated evaluation. That does happen pretty often. And then if your child was evaluated when they're younger, but now they're at the point where they're wanting accommodations on one of these things that I mentioned earlier, SATs, ACTs, college courses, they need to have an evaluation that is more recent. And typically the requirement is it needs to be within the past 3 years. And so you need to think about that when that time gets closer. Maybe it's time to reevaluate if we are going to apply for accommodations. So these are all reasons when you would reevaluate. In some cases, there's no need to. If things are going great and you're not going to be applying for any of these accommodations or needing medication, there may not be a need to reevaluate. So these are some things to think about. So that's all I had for today. I know that's a lot of information, and I think there's some questions, looks like, in the chat. Right, Allison?
Yep.
Let me
Okay.
see
So
if
we
I can
talked
open
about
it
the
up.
out of network. So I know that we have people that attend from all across the state. They're not just in Harris County or Fort Bend County or whatever.
Mm-hmm.
Um, do you have recommendations for finding someone good in their area? So we have people in San Antonio
Yes.
and Austin and Dallas. So
Mm-hmm.
could they reach out to you and then you could make a recommendation if, they weren't local in our area, or do you have other recommendations for that?
Well, okay, so there's a couple things I would say. One is there's a great website that I use all the time, and I share it with parents, and it's psychologytoday.com. And on that website, most therapists and psychologists and mental health professionals are on there. And it's a great way to find someone who has a certain type of specialty. So you can go on there and you can search based on your zip code, based on your insurance, based on the area of specialization, and it includes psychological testing as one of those options. You can also search just for psychologists and narrow it down to psychologists in your area. And so if you're in another area of the state, I would highly recommend using that website. I do it when if I have someone asking me for referrals in Austin, I go first to that website and then I evaluate who I see on there. Now I would say, I'm happy to help find some of those referrals, and I do that all the time for families and clients, but I just may not know, who is the best person to send you to, depending on where you are and what city you're in.
I'm
But
a fan of the Facebook special needs mom groups. There's a lot of
yes,
wonderful Facebook special needs moms groups. And when you ask a question like that, the stars are going to keep rising up. You're going
that's
to hear the
right.
same names over and over and over again with a lot of parents that have kids similar to yours that have a lot of experience. And I find that that's a good way to sort. You might get
Yes.
5 or 10 names and then sorting through those and then using the psychology today or whatever. But
Yeah, I
a lot of
agree.
those groups, they won't lead you in the
Word
wrong
of mouth
direction.
is a good
Veteran
way.
moms,
Yes, they know because they've been there, done that. Yeah.
yes.
And I would also say use the information I shared with you today to find an evaluator that's a good fit. So think about those credentials I mentioned earlier and, make sure that they have those credentials. Find out how they do their evaluations. What does it involve? Do you get a detailed report or a one-page report? Is there a results session where they're going to go over those results with you? Is the testing going to take 30 minutes to do a full evaluation? That's not a good sign if that's what you
Right.
find out, right? So ask these questions because now this is the information you need to be keeping in the back of your mind of what a good evaluation should look like and who should be doing it. And then you can go out and you can assess who you're finding. You can look at their websites, you can call them and ask these questions.
Very good. And just as a reminder for everybody that attended, you are going to get an email probably tomorrow with a link to the recording and a copy of the slides. So all of the links and everything that she talked about, so you can kind of reference credentials and stuff like that. That's going to be in the slides. So just wanted to remind everybody for that. Well, we are about out of time for tonight. Thank you, Lindsay. As always, you're always
You're
fantastic. Lots
welcome.
of good information. And I, like I said, I'm a fan. I'm a fan of testing. I think it's valuable.
Hmm.
And I think thinking as a parent, like, why do I want this? Do I want this for accommodations? What am I going to do
Yes.
with the data? I mean, you can spend thousands of dollars getting testing, but if you don't take action with the recommendations, I mean, those are other thoughts of kind of, do you have the bandwidth to
Mhm.
take action on the recommendations and things like that? So lots to think
Right.
about, but valuable information as well. So, Lindsay, thank you so much. Thanks everyone for
You're
being here
welcome.
tonight, and we will look forward to connecting with you guys again soon. Bye now.